A lot of women want to know what they can expect with postpartum bleeding. And if you take a period that normally lasts 4 to 7 days and stretch it out over 3 to 6 weeks, that's basically what you're going to get after you have your baby. And the bleeding will be the same whether you have vaginal delivery or a C-section, because the bleeding is coming from the healing uterus. And that's the same no matter how you deliver. So the first couple of days of a period, you experience the most significant bleeding, like the amount is greatest. It's going to be over the course of the week that you're on your period. It's bright red, and you experience the most significant cramping. So that's very similar to the first week or two after you've had a baby. You experience the most bleeding, it's bright red, and you experience very intense cramps, especially associated with nursing if you are breastfeeding your baby. After that, in a normal period, you start to taper off an amount, and it changes to maybe like a pinkish-brownish color for a few days, and then it goes back to normal white discharge for the rest of your cycle. And that's pretty much what happens over the next, so week 1 or 2, or when you experience the heaviest, most significant bleeding associated with most pain. Weeks 3, 4, 5, 6, you should start to taper off an amount. It will change to like a brownish-pinkish color and then go back to normal white discharge. If you've had a vaginal delivery, your doctor will see you at 6 weeks postpartum and ask you about your bleeding. If you have a C-section, you'll probably see them at 2 weeks postpartum and then again at 8 weeks. And at each appointment, they will ask you about your bleeding. If at any point you've slowed down and then you start bleeding again, there's a possibility that just maybe you're doing too much too soon. The uterus needs to heal, so if you've increased your activity level too quickly, then you might start to see a little bit more bleeding. So let's say that weeks 3 or 4 after you've had your baby, your bleeding has slowed down significantly. You're just kind of seeing a little bit of pinkish spotting here and there. But then you got this itch to clean your house, go grocery shopping, do the laundry, and walk around the block a few times with your baby. Maybe that was too much for you, and at the end of the day, you start spotting or having more significant bleeding. Rest. Make sure it goes away, and if it does and it tapers back off, you're okay. But if it continues to increase, then you need to call your doctor. Other reasons to call them are if you saturate a pad in an hour, if you're passing clots, or if your bleeding never seems to be slowing down. There are some things that can cause you to have a postpartum hemorrhage even weeks down the road after you've had a baby. The doctor will ask you more specific questions, perform an exam, and decide if further investigation or medical intervention is necessary in your situation. During this time while you're bleeding, you need to use pads and not tampons, because what's coming out needs to come out so that it doesn't stay inside and fester and cause infection. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/InnerMountainMoms, and recommend us to your friends and family too.